Hi, this is Dr. Bhojraj from VR Spine, and I am today trying to answer two relevant questions related to spine. The first one is, are there any non-surgical treatment options for spine? Of course, yes. 80% of spine problems do not need surgery. 80% of spine problems need good counseling, good posture advice, a set of good exercises to strengthen your core, a bit of medication, and sometimes maybe some type of bracing such as a collar or a belt. So all these combined could treat 80% of the spine problems. So definitely 8 out of 10 patients are not going to need spine surgery. The second important question is, what are the broad types of surgeries we do for spine? Now, the very important thing in spine is release of the nerves, because things can get out of place and compress on the nerves or the cord. So there is something called as a conventional surgery, which is an open surgery, which is a time tested surgery which gives consistently good results. But now people are coming out with different newer techniques, what is called as a minimally invasive surgery, which means you do the same type of surgery through minimal incisions with robotic support with navigation. So this is quite helpful for the patient, but obviously it requires very specific training. The learning curve is very big, and we should not undertake such advanced high-tech surgeries unless you have the right equipment and unless you are well trained, because the learning curve is very steep. However, if someone is very good in these techniques, it could be a best option for certain indicated spine problems. Thank you.